I'm Dr. Sandra Adams, an Associate Professor of Medicine in the Pulmonary Critical Care Division of the University of Texas Health Science Center at San Antonio, and staff physician of the South Texas Veterans Healthcare System in San Antonio, Texas. The article we're going to talk about today is entitled Impact of a Primary Care Continuing Education Program on Clinical Practice of Chronic Obstructive Pulmonary Disease, or COPD, Translating Theory into Practice. And it's to be published in the Mayo Clinic Proceedings. The main purpose of this article is to describe how the American College of Chest Physicians, or ACCP, brought together a multi-specialty, multidisciplinary group of experts to develop, implement, and assess an interactive continuing education program on COPD for 351 primary care clinicians in 20 cities throughout the United States. Unfortunately, many times educational activities that are not able to document improvements in clinician knowledge or performance. However, research supports the fact that activities that are planned using specific adult learning principles can demonstrate improved clinician confidence and performance. Our collaborative group consisted of subject matter experts, including a family physician, nurse practitioner, respiratory therapists, and pulmonologists. We used a systematic instructional design approach to assess, design, develop, implement, evaluate, and reproduce a one-day interactive continuing education program. In this article, we also introduce the ACCP's 6 learning categories and demonstrate how these categories can be applied to develop an effective continuing education program on COPD. We used an audience response system to administer pre- and post-course assessments. We discovered that the participants' self-confidence, knowledge, and comprehension significantly improved following the program. In the last 15 programs, we asked participants to commit to one or more changes that they were willing to try to implement in their practice as a result of what they learned in this continuing education program. 87% of the participants completed a total of 971 statements, committing to change at least one thing in their practice. Of the 49% who responded to the follow-up survey, 70% reported completely implementing at least one clinical practice change. In fact, 94% of the respondents reported that they were able to at least partially implement one or more clinical practice changes in the months following the educational program. The learners committed to a variety of practice changes, but the top 3 involved increasing the use of spirometry, case-finding questionnaires, and guidelines to diagnose and manage patients with COPD. Now, what this means for patients is that interactive, dynamic, collaborative, and reproducible continuing education programs that use diverse instructional models, teaching techniques, and media can change how doctors, nurse practitioners, and physicians' assistants care for their COPD patients. Ultimately, when clinicians are successfully educated on what to do based on the best evidence available, patients are likely to get better care. The next steps include, number 1, expanding the education beyond the limited number who could attend one of these courses through a web-based, interactive, professional education in COPD program entitled WIPE COPD. More directly measuring clinical practice changes in patient outcomes in COPD through quality improvement projects, and finally, using these strategies as a template to create continuing education programs on other medical topics. The bottom line and take-home message for this article is that through teamwork and collaboration, educators can truly develop effective, interactive, and fun continuing education programs by applying systematic instructional design principles.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.